PreventConnect is a national project of Valor US, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or Valor. All right, so we have a couple of objectives for us today. And so we're looking at thinking about how do we think about community engagement frameworks and build some foundational knowledge about what those can look like, thinking about some of the barriers and how we can address that within the sexual and intimate partner violence prevention field when it comes to engaging community, and then think about some partnerships between public health prevention practitioners and community leaders who are working to prevent violence. And I'm really excited. We're going to hear from our presenter today in just a few minutes, but I just wanted to give you a preview and let you know that we're really lucky to be joined by Amber Akeni-Pyatt from the Human Impact Partners, and I'll share a little bit more about Amber in a minute. But I want to actually hear from you all first. And the first question that we want to ask you all is really, what does authentic community engagement mean to you? When you think about authentic community engagement, what does that look like? What are some of the maybe values or principles that you hold around authentic community engagement? So we'll see. The chat has been very active with people introducing themselves, which is fabulous. I see some answers coming in. So sharing decision-making, humility, nothing for us without us, shared power, accountability, compassionate, reciprocity, again, real reciprocal relationships. Wow, things are coming in really quickly. Showing up, tangible outreach, lots of different people at the table, listening, transparency. Again, I see listening, understand, oh gosh, I just lost it. Understanding the dynamics of what's already there based on assets. These are so great. Empowerment, education, community at the center. Gosh, check your biases at the door. There are so many wonderful principles that you all are putting in here. I really appreciate you sharing what authentic community engagement means to you. Open the door, strength, space, listening and hearing, they just keep coming in. That's really fabulous. Janae, if you go to the next slide, thank you for sharing a bit and for continuing to share what authentic community engagement means and looks like to you. It's likely going to look different depending on the context of any given community. But I think what does stay the same is that many of the prevention strategies and approaches that are being implemented really require community engagement to be successful and meaningful. And so we just look at some of the prevention strategies in CDC's technical packages, like building skills, promoting social norms, creating protective environments, strengthening economic supports, on and on. All of these require community leadership, community buy-in, community support, and community involvement. So community engagement is really, really critical. Janae, if you'd go to the next slide, beyond looking at implementing evidence-based prevention strategies, community engagement is needed to advance health equity, or the opportunity for every person to be as healthy as they want to be. And communities have different needs, and a health equity approach to preventing violence looks at the factors that contribute to violence and to safety, and specifically understands and addresses the lived experiences of oppression that exposes some communities to higher rates of violence. And this is a quote from an NSVRC document looking at a health equity approach to sexual violence. And I'm gonna put that link in the chat. Apologies for my barking dog. He thinks I'm talking to him, so that's fun. All right, so if we go to the next slide, I think that what's happening in this quote is that we're really getting to a point raised by this interviewee. And this is from a research paper on leveraging community expertise to advance health equity by Urban Institute. And I'll put a link for that in the chat as well. But what it's getting at is the fact that communities know what makes their lives better or more difficult, what makes them safe or not. Yes, thank you all. I'm looking at your chat comments about this barking dog. His name is Pretzel, by the way. And communities know what their assets are and also what their needs are. And so without significantly involving communities in anything meant for them, it really becomes a guessing game at best. But I think what's more likely is a situation in which false solutions are being forced, creating less equity and more distrust in the long run. And so, Janae, if you go to the next slide, Pretzel, he really does think I'm talking to him. Oh gosh, okay. So there's a lot of ways of looking at community engagement, different models, different practices, and Amber, who we cannot get to fast enough, is going to be sharing some perspectives on that. But what you're seeing on your screen is, I'm going to mute myself for one moment, and I'm going to try to quiet him. Give me one moment. Okay. Hello, I have returned. So I think he got the message. So what you're looking at on the screen is an example of how the Minnesota Department of Health is looking at supporting health equity through community engagement. And so on their website, and again, we're gonna give you all these links. We'll also create a downloadable PDF following the web conference where all of these resources will live. But they're very explicit in how they're thinking about community engagement. And I'm gonna read you what they say. They say engagement must be authentic. Health departments must go beyond forming intermittent relationships for the purposes of gaining feedback. How often do we see that that's how we engage community to get their feedback? They go on to say, and instead seek to build a sustaining, lasting relationships. In these relationships, a health department must be willing to listen and allow the community to lead the work. We should not use engagement as a way to confirm or advance a pre-existing idea or agenda. So again, I will put that link in the chat for you. And I appreciate everyone's support. Okay. Janae, if you go to the next slide, in addition to different community engagement models and practices, there's also different ways to assess the level of community engagement that's happening. And so this is an example of a conceptual model. It's actually from the National Academy of Medicine. But what it's doing is it's illustrating some core principles of community engagement. And I know it's probably not the most clear image, so let me give you a link so you can actually see what those core principles are. So it has the core principles of community engagement in the middle. It's the green area. And then there's a range of outcome options that are dependent on the stakeholders and also the community context. And so in this assessment model, there's 4 broad categories of measurable outcomes. And so for their purposes, they have strengthening partnerships and alliances, expanding knowledge, improving health and policies, and thriving communities. And then each of those categories or domains has potential relevant indicators to help understand the level and outcomes of the community engagement. So I just wanted to share some examples of how community engagement can be assessed. On the next slide, there's actually a more simplified assessment tool which is the continuum of community engagement. And this can also help those starting to look at community engagement as a process and a strategy to kind of plot out where they currently lie and plan how they advance engagement. So I know I just put a lot of links in the chat, and again, we'll include those in a downloadable PDF following the web conference. But now I want to officially turn it over to our guest today to learn how Human Impact Partners is thinking about community engagement and health equity. So I want to welcome you and introduce you to Amber. Amber, how are you today?
I'm doing great. It's so nice to be here.
That is wonderful. Oh my gosh, thank you for being here. So I just want to share really quickly with our audience. Amber Akeni Pyatt is the Health Instead of Punishment Program Director at Human Impact Partners, a national nonprofit organization focused on transforming the field of public health to center equity and building collective power with social justice movements. Amber's work advances health equity, racial justice, and public safety by shifting away from criminalization, incarceration, and surveillance and toward community-led solutions. She completed her Master of Public Health from the University of California, Berkeley, and a Bachelor of Arts in Psychology and Spanish from the University of California, Los Angeles. So Amber, welcome again. We're so excited to have you. I'm sure you've seen that the text chat has been very active, but I'd love to just learn a little bit more about Human Impact Partners and how you all are thinking about health equity and community engagement.
Yeah, thank you so much, Ashley and Janae and Pretzel and our captioners. I'm really, really grateful to be here. I was trying to read through all of y'all's introductions in the chat and was just so impressed with the number of places. I want to give a special shout out to the person here who's at Cal State Northridge, CSUN. I grew up a mile south of there, and it was fun to see CSUN on the list. So yeah, I'm here to chat about community engagement. Yay. And there are kind of going to be two sections to this, and hopefully we'll be able to chat as we go. Please feel free to drop questions if you need any clarification. Please also feel free to let me know if I'm talking too quickly. My mom and grandma will never let me live down how quickly I talk, and so it's a forever practice in my life to slow down and make sure I'm not rushing through things. And yeah, and if you have sort of comments as we go, or if something's resonating or not resonating, I would love to chat sort of virtually through the chat function as well. So that is what we're doing. Nice. And I should say, now seeing someone in the Bay Area in the chat as well, I'm based in Oakland on Ohlone land now. So still California, but grew up in LA. And yeah, okay. So first, I just wanted to put this here partially just for accountability with myself to ground in what we're here to talk about. This is the description that you all saw when registering. And there's so many things we could talk about within this topic, but this is sort of what we're talking about today. So I'll read this out loud, just so you're not having to pick between reading and listening. So it says here that building authentic community engagement in sexual and domestic violence prevention is an important aspect in building safe, healthy, and equitable communities. Community engagement allows the lived experiences and knowledge of community members to guide and drive solutions and gives insight into the conditions in which community members live, work, and play. Engagement strategies that advance health equity are intentional in who is engaged, how they are engaged, and to what end they are engaged. Join PreventConnect and Human Impact Partners, that's where you are today, for a discussion about the connections between structural inequities, violence prevention, and community engagement. Okay, so to start, I'm going to start us with a conversation around power. And let me say a word about why. So my early work was in sexual and domestic violence prevention work and intervention work. I started doing mental health direct service and research largely with young people who had experienced trauma, much of which was violence, some of which was sexual and domestic violence that they were themselves experiencing or witnessing in their home. And so that is sort of the beginning of my career. I decided to go back to grad school in public health because I really wanted to sharpen the tools in my toolbox and my analysis around how we prevent violence and harm. And I was in grad school 2013 to 2015. Those dates are relevant for many reasons, but one of them is that that was during the Ferguson uprisings. And because of organizing I was doing on campus, with women of color, but particularly with Black women, I really came to understand that my privilege as an East Asian, light-skinned, cis woman had really shielded me from the ways that policing and incarceration continues to wreak havoc and so incredible harm in communities of color. I, as a Japanese American person, understood that in my familial context and sort of had this privileged view that that was an issue that ended in the 1940s with my family's release from the incarceration camps that they were placed in for being Japanese American. And of course, that wasn't true. And because of the Ferguson uprisings, that became more of a national conversation and became part of my understanding and thinking around how we respond to sexual and domestic violence. So then I sort of transitioned into thinking about non-carceral, non-police responses for survivors, many of whom can never and will never go to the police for anything looking like safety or accountability, because that's not what the police provide. And so started doing that work, and then over time have transitioned into doing more state violence prevention work. So thinking about police violence and incarceration itself as a form of state violence and moving toward preventing that. So I give this as a grounding for why we're going to talk about power, which shouldn't be a surprise to many of you. I appreciated that in the question about what does authentic community engagement look like, sharing power and power came up so much in the chat. And so this is not, I am not saying anything here that is new for many of you. And in fact, many of you could actually probably present exactly this and do it in a fuller and different way. Well, we're figuring out slides. But I think that there's an interesting thing happening in conversations about structural power and how we build power to change conditions and structural inequities, and the ways that in interpersonal violence prevention, we talk so much about power and control in the context of sexual and domestic violence. So there's this piece here around social control, power, and I think that what I'm going to try to do is hold a lens that is inclusive of the ways that individual and interpersonal violence shows up, but also in a way that can expand and have a conversation about how structures and systems drive and create conditions that allow for interpersonal violence to happen. So, Ashley, if you could go back a couple slides, or is this the first power slide? I don't remember what order.
I sure can.
Thank you.
You tell me where you want me to stop.
All right, so I wanted to start us with a quote from Dr. Martin Luther King Jr. saying that power is the ability to achieve a purpose, whether or not it is good or bad, depends on the purpose. So I think sometimes in my work around sexual and domestic violence, we use power and control and always inherently mean it to be negative, that someone is exerting power or control over somebody else. And so here it felt important to name from the beginning that power is not inherently bad, nor is it inherently good. It's really about what goal you're trying to achieve. So just wanted to start with that. Let me go to the next slide. So when we think about structural power and being able to shape the structures and systems and environmental contexts in which interpersonal violence can happen, I wanted to lay out a few different forms of power that we can think of in this organizing context or structural context. So one could be around the power to win a specific election or decision, be it legislative, be it administrative, be it institutional or societal. So we can talk about the, state laws, federal laws, regional policy, but we also can talk about institutional policy and things like what our funders allow us to use our funding for or not. Those are decisions that largely shape our work, right? And will shape the conditions in which violence can happen or doesn't happen, and the conditions in which people can heal. So organizing people and resources for some sort of direct political action to influence winning a specific election or decision is one sort of way to think about power. Another is around power to set the agenda. So building the infrastructure to shape the political agenda. And this comes from work around the different faces of power, and I can drop a link to that maybe when we're going to do a journaling exercise shortly, just to give space for you all to reflect on this. So I'll drop a link during that time. But one is, around power to set the agenda. So what are people talking about? What is driving the conversations? I think here, for example, about things like what's happening in popular media. I think there's been a very interesting shift of true crime, like podcasts and shows and that sort of thing becoming very, very, very popular. And that's a way for me, I think it's a way for the popular media to be absorbing and responding to and be in dialogue with conversations we're having about structural violence, police violence, and the like. So being able to set that agenda and being able to build infrastructure, also thinking about who has financial resources to be able to hire organizers or staff or people who can dedicate their time and energy to building up the political conditions that we need for whatever it might be. Next slide. Another, and that's related to the last one, related to all of them, is the power to change or hold public narratives. So shaping how we make meaning of the world and our place in it. So working in public health now, a thing that is a consistent source of frustration for me is that public health tends to be, governmental public health in particular, tends to be pretty risk averse. And there's so many reasons for that, including the divestment from public health that has happened, especially over the last 15-ish years. But there's so much information for us to take in all the time. And so we have to build sort of mental schema, build ways of understanding what we're seeing out in the world and being able to take in the information without getting completely overwhelmed, though of course the information we need to take in still can be quite overwhelming, especially in the last couple years. And so being able to change and hold the public narratives around things like what is fairness, right? Like, and maybe I'll just pause here for a second and say, there's research around sort of core values that drive human behavior across any number of spectrums. And one of the values that is universally held by people, though understood differently across different groups of people, is fairness. And so, for example, a painful thing that's happening in our country right now is the formula shortage, which just absolutely devastates me. And anyway, that's a whole other webinar. But there's a lot of conversation happening about the formula shortage. And if we think about through the lens of fairness and how it relates to public narratives, we have this situation of a formula shortage, and there are people for whom the solution, including elected officials, who have tweeted things like US citizens should get access to formula before people who are not US citizens, before immigrants and refugees, asylum seekers, and others. And they're using the lens of fairness, that it's only fair that US citizens get formula before immigrants. And then there's a whole other spectrum of people. It's like, fairness is fair, like babies need to be fed. What is fair is that people don't have to fight to be fed and that people can be healthy and safe and nourished. And yet these are both in this like so-called name of fairness. And so the being able to drive how we as a public, as a people, talk about and understand issues is actually a tremendous amount of power. It is not exclusively done through media, including the news and mass media, but is a lot of the work that many of us can do around how we talk about, for example, sexual and domestic violence to be destigmatized, and the like. So that's another form of power that I think really influences structures. Next slide. And so why does all of this matter? So this is an image that we have at HIP around basically our theory of change, that we believe structural oppression comes to be because of power imbalances, because of concentrated power among certain groups of people, particularly wealthy white men, for example, corporations, for example, and that those power imbalances drive structural oppression. And so some of the outcomes of those structural oppression are listed at the bottom that you can read along various what we call social determinants of health, the social or environmental factors that actually determine your health status. And so to me, when we think about why, so again, coming back to why this matters and how this relates to community engagement, I think that there is a lot of good work that can happen in community engagement, and engaging the community without a lens around how to build collective power that will shift the conditions at a structural and systemic level isn't going to get us to liberation. It's not going to get us to safety. It's not going to get us there, because we're tinkering at this very downstream individual level issue if we're not holding a lens of how our work can bubble up to shift systems and shift structures. So given all of that, all of this really guides a lot of how Human Impact Partners, HIP, my organization, thinks about and engages with community members and how we sort of spend our resources, which I'll chat about in a bit, but wanted to sort of take a pause. I know a lot of this can be kind of heady. So I don't mean to intellectualize this, because this is very real thing. These are very real things that impact our day-to-day lives. So both, it can be kind of heady and it can be heart heavy. It can be difficult. Like I can notice myself when I read things like families separated. It's like I feel a tightness in my chest. I feel myself talking faster to sort of work through the tension that comes into my body when I'm confronted with looking at and remembering these real harms and struggles that people are dealing with every day, right? So we wanted to give a moment here just to do some journaling, to come back to ourselves, come back to our breath, come back to our bodies, and just think about how this is landing. And so if we can go to the next slide. So just take a few minutes, maybe we'll come back at 36. You can answer any one of these. We are not going to ask you, you will not be forced to share these with anybody. You can put things in the chat to share your reflections with others if that feels good for you, but just take a few minutes. You can, so the first question, I'll read them out loud for folks. The first question just says, in violence prevention work, we talk a lot about power and control. How does my understanding, as in you, how does my understanding of interpersonal power dynamics influence my understanding of structural power? So you can reflect on that. Another question you might reflect on is, how have I shared, I as in you, how have I shared power or built collective power with others, especially community members? And then third question and offering is, what do I notice about how these reflections are feeling in my body? Am I tensing my muscles? Am I taking shallow breaths? Am I clenching my jaw? So let's take till 36 to do some on paper, or just sort of mentally reflecting on this, or just breathing, stretching, taking stock of how this is landing. And we'll come back in a couple. Thank you. Okay. I hope everyone had a nice little break. Rolled your neck out like I did, maybe grabbed some water, did some journaling. If anyone wants to share anything that you were journaling about, feel free to drop that in the chat. But we also have some other questions that we are excited to come to shortly. So in this next little bit of time, I'm going to share some about how HIP approaches community engagement. This is one way, this is how we think about it. I'm not purporting for this to be the correct way to do community engagement, but it's how we think about this work, right? And how, given our resources and our relationships and our mission as an organization, that we think about this work. So the first question we would love to hear from you all with is how often does your organization engage with community members? And awesome. So it just showed up as a poll. Seeing things come in, seeing a lot of often and sometimes, and a bit of never and rarely, but a lot of often. Y'all are so on it. More than half of you already responded. I'm so impressed. Great. Yeah, a lot of often and sometimes. Cool. Okay. We can end this poll. Awesome. Cool. So you can see here 67% of you, so 165 out of 248 of you said often, 25% said sometimes, 7% said rarely, and 1% said never. So that is interesting. And so that kind of gives us a little bit of a flavor. And then in the text chat, if folks want to put in, what do you think that your organization does well with community engagement? So, give yourself some props. What do you like about what's happening? For sure. Building relationships, lots of listening, bringing awareness to the community on issues, listening to community members, long-term partnerships, not much, that's real. Our community is really involved based on years of interactions, prevention education, making our sales available, one-on-one student interactions, thriving as a community, prevention education, relationship building, listening, asking questions, connecting them to resources, humility, collaborating. We have diverse connections, engage lots of different parts of the community, coordination. Great. Great, great, great. So many things. Oh my goodness. Humanizing, helping, culture sharing events. Love that. Awesome. Supporting victims. I'm seeing this, they were coming in very rapid and now they're slowing down. So maybe we can go to the next slide. This one might be a little touchy, I'm just going to acknowledge, but what do you wish your organization did differently with community engagement? So if you feel comfortable sharing something to that. Events. That might be for the last one though. I wish we were more proactive than reactive. So real. Showing up with an open mind rather than an agenda. That makes me think about that piece right around the power to shape an agenda. Including community and long-term planning and strategic planning. Also a power to shape an agenda, right? Wishing you a dedicated budget and position for community engagement. Yeah, truly listening to the needs, collecting data and not assuming. Community over funders. That's a whole word. Pay me more money. Yes. I wish our website was more survivor driven than donor driven. Yeah. Yeah. Yeah, it's very unfortunate how much funders, how much power funders have to shape so much of the work, right? More individuals who are passionate. Doing more concrete things with the feedback we receive. We should come back to that. That's, yep. Reach out to the city power structure to get more of their involvement. That's real. It's not my organization. The community is reluctant to allow us to engage. Lots we could unpack there. More engagement, encouraging collaboration, less one-offs, closing the feedback loop. Having more synergy with local government and their support. Yep. Be aware of tokenization and overuse of the community. Very real. Social media, participatory approaches to funding, less red tape. I'm seeing a +1 to this comment around, I wish we'd been honest about the fact that we're only engaged in sharing what we want to highlight, not actually listening. Yeah, so maybe to that, I'll say one of the slides that Ashley shared early on, let me go back and find it, around assessing community engagement. When we maybe could go back to that slide if we wanted, it's slide 16. And differentiating between outreach, consult, involve, and collaborate. So to me, I think about it is very important to stay honest. So don't tell a community member or community group that you're collaborating with them when actually you're just consulting with them. So being really honest about how much power somebody has so that they can make determinations about how to spend their precious time, and not sort of being duped into thinking that they're going to be in a decision-making seat, right? I think especially in work that involves trauma, pain, sharing people's, like if someone's being asked to share their story and it's actually not going to drive change, and the reason that someone's sharing their story is to drive change, I think that can be a form of re-victimization and re-traumatizing. So being really, really honest, and that can be tricky just to like name, right? Like that can be tricky in an organization. If you are a staff person who is implementing a supervisor or higher ups vision for something, and you are committed to collaborating and you want the community members you're engaging with to actually be able to influence something, but if your supervisor is not going to allow that, then that can be a difficult thing to negotiate organizationally, and then in how you communicate with the folks that you're bringing into your space. So yeah, I want to lift up a comment here around accepting that white colleagues will have and create different community experiences than Black, Brown, Indigenous peers will, which is also incredibly real. And a thing just to like add on to that I think about is how sometimes the Black, Brown, Indigenous staff will be put in front of those audiences to try to elicit more like stories or input or buy-in. And then actually it's just like, it's tokenizing, right? It's just, let's put this Black, Brown, Indigenous face in front of people so that we will be able to extract from the community what we want, but then we're still not going to actually collaborate or share power for decision making, right? So not allowing ourselves in a given identity to be exploited in that way and to be exploited in service of extracting from community members. So lots of dynamics there, right? And I think certainly, you know, at HIP, we think that structural racism, that is it is our primary lens through which we view structural oppression. But of course, there's also issues around, you know, putting a trans person in front of a group of LGBTQ people to try to extract stories and information from those folks, and then still having a very heteronormative, transphobic, etc. Lens to the decision-making work. So there's multiple ways we can think about this, though our view at HIP is that oppression flows from structural oppression, and particularly structural anti-Blackness in the US context. So appreciating that. And yeah, okay, so let's go back to slide, where were we? Slide 30. Let's go to slide 30 maybe. So so community engagement work, I think of kind of similar to the way that I think about like equity, right? Like it is both a process and an outcome. And it is a forever process. Like we will forever be iterating on how we do this work, improving the work, shifting how we do the work in different communities and for different audiences, right? And so there's not a sort of one size fits all situation here. And I also know that sometimes we just want the, like, what are some small things or sort of orientation shifts that I can make that will, if I follow these, it'll help me get a little bit further down the path. And so these are quick tips, maybe in that they're short in number of words. They are not quick necessarily in what they would take to implement them. And a lot of these things, I think, relate to what folks were putting in the chat early with the question around what does authentic community engagement look like? So one is to build upon existing networks. So if you don't see existing like community groups or networks to be engaging with, then you just haven't found them yet, right? And I think there's also, someone had put in the chat earlier around that the community is not willing to be engaged. And so I think that in that sort of situation that can happen, which can be very, very real, it's like, okay, so then why is the community not willing to be engaged? Is it because your organization or center has a relationship with the police, and the community members, because of their immigration status or because of the ways that policing is inherently anti-Black, then maybe they're not willing to engage for fear of talking with you and you being a mandated reporter, or just being someone who's comfortable and with the police and believes that the police should be involved, that sharing those stories or engaging with you might lead to police intervention in their family, and they don't want that. And so there are many, or maybe you're hosting events at hours that don't work for people with young children, or work for people who work multiple jobs, or maybe because they like all of their time has to go to working or family responsibilities, and you're not offering stipends for their participation or feeding them when they come. So there are all kinds of reasons why community members might not engage with your organization. And so to me, it's important to always acknowledge that there are folks who are organized and networked and coordinated. And it's our job to create spaces that are worth those people's time and energy. So that's one. Another is to center those who are impacted. So, you know, in this work, that often means centering survivors. And I think that there's, for a variety of reasons, including the uprisings in 2020 in the wake of George Floyd's murder, there's been a reckoning of spaces that have been predominantly white. And so when I say center those who are impacted, I here largely mean survivors, but also are the survivors who are being centered, the white survivors, the educated survivors, the like perfect victims who tell a story that is really neat and tidy for a binary between a survivor and a person who's caused harm. And so we have to really think about how we are centering people who are impacted and who sit at the crosshairs of multiple forms of oppression, and creating space and recognizing that if it is true that the folks who are engaging with us and the folks who we're centering in the work are people who have layers of privilege, then what sort of organizationally can be done to shift practice such that some real accountability work could happen, organizational accountability, and or some expansion of sort of who the precious community that your organization is caring about and serving can be expanded. So that's another one. Another is to invest in relationships. That came up so many times in the chat. I don't think I need to overstate this. I remember one of the things saying like one-on-one with students, and that is so powerful, so much, you know, this is also in community organizing work, that one-on-ones cannot be forsaken. Like that is just, I think so much of the work that I do is around building relationships, building trust, and that just happens through coffee and through like chats with people and getting to know people and knowing things about their lives. And you can't sort of shortcut that, right? Another is to walk with humility. Humility also came up a lot, enough that I grabbed a book that I'm reading. I'm reading, I don't know if anyone else is reading Brene Brown's Atlas of the Heart or watching her new series on HBO Max. This is not an advertisement, but I just read her last chapter of this book. And in it, it's a chapter called Places We Go When We Self-Assess. And one of the things that she put in here is around humility. And I really appreciated her definition, and I want to read it to you all because I think it's relevant. So she defines humility as an openness to new learning combined with a balanced and accurate assessment of our contributions, including our strengths, imperfections, and opportunities for growth. So the new learning piece, I think, speaks to what so many folks have been putting in the chat around not listening, like actually listening and not just collecting information and making assumptions and this sort of thing, right? So an openness to new learning is so important in this work. If we're engaging with community, if we're just giving people information, that's fine. There's a time and a place for that. But if we actually are trying to be in conversation, we have to have this humility. We have to have an openness to new learning. So I wanted to name that. And the last thing is to share appreciations early and often. This work often is really thankless. And it's so important for morale, for an understanding, also to make space for having hard conversations where we need to give people feedback or offer criticism and critique. This is like another part of my like universe back in my psychology days was working in an intimate relationships lab for like 4 years, where our fundamental research question was, why do people fall out of love? And it's, you know, interesting how much the research on how we build sustainable and healthy and satisfying marriage actually relates to so much of our work in building programs that are healthy, sustainable, feel good, and also in communities and environments that are sustainable, healthy, feel good. And so much of that is about the ratio of criticism or critique, negative feedback to positive feedback. And we need to be giving it something like, I don't know, a 3-to-1, 6-to-1 ratio of positive to negative is how we can help build containers that allow for the negative feedback to be able to breathe. And so sharing appreciations early and often, and just practices of gratitude also are really good for mental health and social health. So sharing appreciations early and often is an important thing in this work organizationally and with communities. And so these are sort of my 5, like if I could wave a magic wand and like have folks engage with communities in a particular way, I think that these 5 principles are really helpful. And also, I just love this picture of my friend Bobby at a protest we emceed together outside of an ICE building in San Francisco. So next slide.
Amber, I just wanted to, first, this is a great picture. Thanks for sharing it with us. I really appreciate these tips. And there are a couple of things that you said that really kind of made me think of like just talking to people about community engagement and experience that I've had. And, you know, you were saying that there's so many reasons like why sometimes folks don't want to be engaged. And one thing that I've come across a lot is often there's been like harm done historically that maybe like we're not aware of, but people don't forget that. And so sometimes it's worth like, you know, asking about like the history of the relationship with our organizations and the community, because you know, and you talked about this, like rebuilding or building trust is such like a huge part of that. And then the other thing that made me think about is a lot of times I think that like your piece about investing in relationships and it's about like getting to know someone on like their humanness. Sometimes in this work, we don't value that. And I think that that does a really big disservice to when we're trying to do community engagement. You know, I've had people say that they're like questions like, oh, you're meeting someone for coffee? That's not work. And it's like, well, actually it is. Like we have to like have a human connection and build a relationship and trust each other if we're ever going to, you know, really move past anything besides like sharing information. So thank you for pulling those things out.
Totally. Thanks for sort of putting a pin in that. I'm also remembering that I told you all I would send you things about the 3 faces of power, which is Stephen Luke's work. And I'm going to drop probably not the right link, but you know, it'll help. If you're curious to read more, this will give you enough of a starting place to read more about the 3 faces of power. Okay. So next I'm going to just go through, just for sort of example's sake, how HIP thinks about this work. I tend to be a pretty, maybe it's like the qualitative researcher in me. I tend to be a pretty inductive thinker. And what that means is that I'm like trained in grounded theory. So I like to look at individual examples and then sort of understand a generalized pattern from that. Some people are more deductive thinkers. They like to start from a theory and then draw examples from that. So for my inductive thinkers in the house, here we are. So one of the things that HIP does quite a bit of is what we call policy-driven research. And so in that, we partner with an organizing group or advocacy group around a campaign that they're working on and conduct a sort of intensive process of research to uncover what the existing literature says about that issue, and then also collect more data, often qualitative data, often through interviews with folks who are directly impacted by these issues that those organizing groups or advocacy groups already are working with or in relationship with. We do interviews with those folks to be able to inform our research and then put forward products that are specifically intended to be used to create the health case for why policy should change. So here are just 3 covers of reports that we worked on. One was around school policing, and thank you, Janae, for dropping a link to that. So that one is, we partnered with Fresno Barrios Unidos, which is a group in Fresno, which I think someone here, maybe multiple people here are in Fresno. And so they were working to get police out of Fresno Unified School District. And so we looked at the health research on what how school policing impacts individual, family, and community health. The middle one was around ICE transfers. So an ICE transfer is when someone is transferred to ICE, Immigration and Customs Enforcement, upon their release from jail or prison. So that means it would be someone who otherwise would get to go home to their community, but because they are not a US citizen, they are transferred to ICE directly by that jail or prison. So we worked with Asian Prisoner Support Committee and Advancing Justice Asian Law Caucus on a research project around how ICE transfers particularly affect Southeast Asian refugees in California. And so that's that middle one. And then the last one that you see all the way to the right is a research report we did on the health impacts of pretrial incarceration and money bail. And that one actually it's a national level report intended to support bail campaigns across the country. And we do have a research brief specifically that we worked on with Faith in Florida on the health impacts of pretrial incarceration and money bail in Hillsborough County, Florida. So this is an example of a more intensive example of how we partner with community members. And the thing that I would hope that you would take away from this is maybe two things. One, that we specifically partner with organizers and advocates because those are the folks who are trying to shift the structures and systems. So we typically don't, for example, partner with direct service providers for research unless those direct service providers are also doing policy work. So Asian Law Caucus, for example, is a good example of someone who does direct legal service work and also is doing policy change. So we were willing to partner with them. I believe I'm seeing the question about SROs. I think that one is a little bit further up. And so that is one. We are strategic in who we partner with, and in the research process, it's a like 6-month process typically, and the community partners we are in shared decision making the whole way. So they've already decided what the campaign is. We're working with folks who have active campaigns already, and then they are with us for an approving and contributing to the decisions on what even gets considered around what the research questions are, what the research methodology is, how we make sense of what we found, what we do and do not include in these products. So we do not purport to be like an academic, objective research firm. We are putting forward policy-driven research, and also who the audience is for our various products and how we disseminate the products and how we communicate about it. So every step along the way, using a framework that largely comes from participatory action research. So that is how we share power in our research partnerships and how we think about within that shared power of the partnership, how we're trying to influence structural power. So that's one. Next slide. Another way that we engage with communities is by being in coalitions. So these are examples of coalitions we are in or have been in the past. Basically bringing our positionality, our role as a public health organization to an existing coalition. So Decarcerate Alameda County. Alameda County is the county in which Oakland sits in California. So a local group which was seeking to release people from our local jail, Santa Rita Jail, to defund the Alameda County Sheriff's Office and to build non-carceral, life-affirming resources for folks in Alameda County. So we helped found that coalition and or an active part of it to bring a health lens to this work. And Decarcerate Alameda County was sort of reinvigorated at the beginning of the pandemic, which made our voice as public health folks particularly important. So Decarcerate Alameda County. The Dignity Not Detention Coalition is a statewide coalition in California to abolish ICE detention in the state. And again, we bring a health lens to this, and that looks, for example, like submitting an amicus brief about the health impacts of ICE detention during the pandemic to lawsuits. So bringing health voice to that. And then the one all the way to the right is the People's Coalition for Safety and Freedom, which is a national coalition that's seeking to repeal the 1994 crime bill, which essentially built the infrastructure for mass incarceration in the United States. An interesting tidbit of that here for you all actually is that the 1994 crime bill, again, is what built the infrastructure, is what funneled so much money to build the infrastructure for mass incarceration. It was authored by then Senator Joe Biden. And there were a couple of sort of things that were thrown in to sweeten the pot and make this more palatable. And the main one that was thrown in was VAWA, was the Violence Against Women Act. So VAWA was actually part of the 1994 crime bill, and VAWA was used to basically say, like, if you care about women and girls, and you care about making sure that they're safe, then you should be voting for the 1994 crime bill. And so that was a major talking point, and continues to be a major talking point for now President Joe Biden, about why that mattered. So interesting tidbit there. But the things to take away from this is that we at HIP, kind of to the like quick tip around engaging with existing networks, these coalitions we are part of because these are coalitions that groups have already committed to, who are already being invested in, and we're basically trying to be of service inside of those coalitions and being really clear about contributing where we can contribute, but also taking a step back and really following the leadership of the folks who are doing this work. So we don't shy away from the fact that we can contribute and that we have something to contribute and we have a perspective. We don't pretend to be blank slates, but we also are clear that we are not there to enforce our vision. We are there to contribute, given existing alignment to the work. Next slide. And so the last one I want to highlight of how HIP thinks about this work is that one of the things that I did when I came in as HIP's Health Instead of Punishment Program Director was build a steering committee. And the impetus for this was that on a project by project basis, so like on a research project in a coalition or in other things, we had decision-making structures and ways to engage community, but it felt very one-off. And what that meant was that we didn't have a structure or a way to make determinations about our programmatic at a program level, what our priorities are, and to be soliciting feedback overall. And we wanted that. And so we built a steering committee, and I'll read what it says here. So it says, our steering committee helps guide our health instead of punishment program's strategic directions. We believe social change work must be rooted in accountability to people directly impacted by criminalization, incarceration, and surveillance, as well as movement leaders. So these are the current members of our steering committee. And essentially, we recognized, so the thing to take away from this slide is that we recognized a gap in decision-making and shared accountability processes at a sort of programmatic level. We have a board of directors at our organization, but we really wanted for this whole body of work to have a pathway for communication with folks. And I'll name that some of the folks are representing their organizations and are full-time staff members at their organizations, but some of the people are not. So for example, Country, who's with the Deeper Than Water Coalition, he's a currently incarcerated organizer in Massachusetts, and he is not paid staff for the Deeper Than Water Coalition. So we provide stipends for the people on the steering committee who are not doing this work as part of a paid staff position. And we pay people, I think, generously but reasonably for their time. And there's always a balance, right, of wanting to provide enough money that is recognizing people's contributions, but not so much money that it's coercive. Like, could someone actually say no if I said, we need to talk to you 4 times a year, we're going to give you $10,000? Like, I don't know. I wouldn't be able to say no to that. I don't know who would be able to say no to that. And so we want to be generous, but we also want to not be coercive, which of course comes up in research, stipends and compensation a lot, but also felt relevant here. So we pay people for their time, and we are transparent and clear about what our steering committee members have power to influence for us programmatically. Okay, next slide. So that's like the content I wanted to get through. We have a bit more time. I'd love to hear any questions that are coming up. And I like to leave these sorts of conversations with just talk about a whole bunch of things. And it's nice to make commitments. And so a commitment doesn't have to be, I'm gonna burst into the board of directors meeting that's happening next month, and I'm gonna demand that, It can totally be that. More power to you. So thrilled if that's your commitment. But a commitment can also look like, I'm going to reach out to that community member or community group that I've been meaning, it's been on my to-do list and it keeps getting kicked. I'm going to email them, or I'm going to text them, or how you communicate with people. I'm going to reach out to them this week, maybe this month, by the end of May. Or a commitment can look like, I am going to chat with my peer or my supervisor, exactly what Leon just said, about what I learned here today, and see what happens, see what conversation comes up. Or I'm gonna do like an informal evaluation of like, who are we engaging and who are we leaving out from that, and how can we improve that? So you can share them in the chat if you want to, or you can just make commitments to yourself and sort of just think about how you might operationalize some of this, implement some of this. Yeah, I am all for making small and attainable commitments. We totally set ourselves up for failure when we go too big, too fast, right? Like, people who ask me like, how do I get involved in community organizing? Like, oh, find a community group that you love and reach out to them and tell them you will contribute 2 hours a month. That's it. They've got 30 minutes of your time a week. And if you consistently show up, I would, in my organizing, a million times over, rather have the person who will consistently show up for half an hour a week than the person who shows up for 10 hours the first week and second week and then completely dips because it was such an unsustainable commitment. So I'm seeing some things in the chat. Totally. I'm seeing a couple things about staying connected, and my contact information will be on this slide too, next slide too. And yeah, if there are other questions besides the recording, which I'm sure will be shared, please feel free to drop them in here.
I do see Amber, and I apologize everyone. Earlier I was having tech difficulties getting in. We've all been there on Zoom, but I'm seeing some really great points about reaching out to mutual aid groups and high schools. And there are two questions that I wanted to lift up as well. The first one that I see is, what is there for small rural communities? There's a mindset in their community that abuse doesn't happen here. How do we remove blinders and do authentic community engagement in communities that might have less mutual aid groups?
Yeah. So I do not live in a rural community. I grew up in suburbs of LA. I am now, probably this is considered suburbs of Oakland. I don't know. But my dad's whole family is from the Midwest and South, largely in Indiana, Texas, and Florida. And it's so interesting. I get versions of this question a lot, and around mutual aid, around how to have conversations about non-police like safety, care, accountability, infrastructure. And in some ways, like, I recognize that as someone who does not live in a rural community, I probably have no right to say this, but forgive me in advance. I actually think there's so much good infrastructure already in rural communities. I just think about like when my grandmother passed away in Indiana, like, I can't tell you how much food we instantly had on the doorstep. Like, it just, like, there's so much mutual aid that already happens inside of rural communities. I think probably because there's less access to hospitals or grocery stores or whatever the thing is, right? And so community has to come together and take care of each other. Maybe also there's something about, I don't know, I don't have any data on this, but I would be curious to know if there's longer stretches of time that people stay in rural communities. Like, the land that my family's been on in Indiana, it's been in the family for multiple generations, right? And in cities, like, I grew up in cities and I've moved probably 20 times in my lifetime, right? And so I don't know how much of that influences mutual aid networks too, knowing your neighbors, that kind of thing. The data, correct. So yeah, I think to Ant's point, it just looks different. And this is where, like, it's no one size fits all type of thing. And it might be a different timetable. It might be different approaches might work. I'm loving if folks who are in rural spaces. I love that there's a rural organizer. If you want to respond to that, please totally do in the chat. Maybe I can say some of them out loud because I don't know if they'll make it into the recording. So just to read some of these, I see sometimes churches, community centers are good places to start your outreach in those rural communities. Absolutely. Good point about the mutual aid in rural communities. I think it helps when we recognize that it's there and it's happening, but it's not going to look the same or as structured as in cities. So totally to the point earlier about finding the networks that are there. Finding a faith community or one person within the community who you can partner with helps in small rural communities. Absolutely. I live in rural Northern Illinois and work for a domestic violence agency. We have had a fairly successful outreach program since 2016 related to prevention and education. We present in schools, churches, local community colleges. Feel free to reach out if you want to chat more. There's an email there. Finding someone that is already known and allowing them to introduce you. Great tactic anywhere, but maybe particularly in rural communities. Make sure they know you are there, available, and what you can help with. I worked in a rural community in Indiana. I found that addressing the misconception directly is helpful, starting at the place of gathering, churches, etc., and having consciousness, raising conversations about intimate partner violence and sexual assault, and then coming in with the services actions once consciousness is raised. Totally.
I would also add to that. I grew up in a rural community and live in a rural-ish community now. And I think, it really does relate back to everything that Amber was saying, because you have to find what community members are organizing around, and every community organizes around something. So for example, I come from a really agriculture-rich community, and we can make those connections to sexual and intimate partner violence. But going in at the start and saying, I'm from the local rape crisis center, I would like to do some community organizing around relationship violence, is not going to work. Community engagement takes time, and joining those things that are already happening, building those relationships and making the connections over time. And then we help a little bit with what they're working on. They help a little bit with what we're working on, and really kind of build on that intersectionality. We have another question. So I copied this from earlier. It says, I would love any advice, thoughts on how to deepen focus groups and community conversations by getting robust folks to the table. We have a steering community that helped identify priority areas, but are wanting to have survivor focus groups to inform strategies and address those areas. So any advice around that, Amber?
Yeah, I think so. Two things I'll name. So one is, by robust community, I assume you mean like a more diverse set of people who are in the community. And maybe to that point, a couple things. One is there is an approach to this sort of work where you want to have a representative sample. And so what that can mean, for example, is if your community is, 50% white, 30% Black, 10% Latinx, and 10% API, and you have like a very, very small number of Indigenous people, Middle Eastern people, etc. Like, one approach is to make sure that in any sort of community input spaces, and especially community decision-making spaces, that you have about that spread. So you would have about 50% of your, whatever it is, 30 people that are going to be white, 30% of the people are going to be Black, 10% Latinx, 10% API. And then, so that is one approach. There's also an approach that says, if you center the people who are most marginalized, that you will have benefits across. So this is like the curb cut effect, right? So we think about the curb cuts that are put onto sidewalks to allow people who are in wheelchairs to be able to get from place to place so that they're not having to drop off of a sidewalk. And those curb cuts were put in place through tremendous disability justice advocacy for people, with people, by people who are in wheelchairs. And a lot of us benefit from those, right? Like people who have strollers, or who are carrying their grocery carts, or just people who have ankles that are dang tired, like not having to plop off of a sidewalk and be able to walk down the thing, right? So there are little kids who have tiny little legs who need help getting down the sidewalk. there are all kinds of reasons why curb cut actually help everybody and certainly don't hurt anybody, even if you don't use them. And so there is also a sort of approach to community engagement work that does not try to be exactly representative, but actually tries to center those who are most marginalized, because we have an analysis or a viewpoint or an understanding that by centering those people, we will see benefits across, right? So that's what I read into and would say about this, like getting a more robust set of people there. And, you know, maybe one more thing I'll say specifically about that is because of the genocide against Native American people and people indigenous to this land, indigenous and Native people it is a quite small population in the United States. There are still Native people, there are still indigenous people in the US. They have not been completely erased. And so if you live in a community that does have proximity to a reservation, for example, or does have some indigenous people, making sure that you have a few folks from those communities present. Because if you're only ever going for representative, except in a few communities that have large tribal populations, those people are going to get erased. Their perspectives are going to get erased. You can see similar things with like trans folks. You might not have a lot of folks who are out and trans, but trans people are everywhere. And so being clear about who you want to include, even if they don't make up a large proportion or a known large proportion of your community, can be important. And another thing I was going to say is that being clear about what the purpose is and getting buy-in organizationally to be able to shape, like leaving enough wiggle room in your strategic plan or in whatever it is to actually be able to take in information, and being clear about at what stage you're taking in information. If you're like, we're launching a new hotline or whatever it is, I don't know what it could be. Launching a new program and it's basically already fully baked, and then you're trying to get input, like people are smart, people know. It's like, you're putting a fully baked program in front of me and asking for my input. Like, you don't want input, you just want my approval. Like, and so being able to engage folks early on is important. And sometimes that might look, for example, like you see a funding proposal, a call for proposals go out, and working with community members at that stage so that what you're proposing in your applications actually aligns with what the needs are of people. And I am more likely to give input and to engage with folks when I see that previous input I've given has been incorporated. I'm like, that group constantly is asking me for stuff and they never do what I tell them. I'm not going to keep telling them things. It's just frustrating. No one wants to do that. No one has time for that. So a good way to engage people is to show people that you're willing to collaborate, willing to share power, and willing to take their perspectives and include that in your decisions.
Thank you, Amber. And if we have time, I have just one more question that I saw pop up in the chat that everyone might be interested in. And that was someone asking about how to turn some of these things into measurable outcomes and deliverables that are required in their funding.
That's a good question. What gets measured matters, as they say. Yeah, I think some of the things that come to mind, for example, are like, what are quantitative and qualitative process indicators, outcome indicators. So what I mean by that is like quantitative. So you could have things like number of community members who took a survey to give input on a thing, or like number of community meetings hosted to talk about our new pilot program. So like numerical. There's also qualitative things. I always, these things can be hard to measure. I'm sure there are like validated scales, something around community power. Process indicators versus outcome indicators. So process indicators are things that tell you how good or not great a process is. So, someone is satisfied with how the conversation went or whatever. Versus outcome indicators are things like someone, like direct quotes were in our strategic plan, and whatever the other things are. So I would think about metrics, both that are process indicators and outcome indicators. I would think about metrics that are quantitative and qualitative. And I would caution against, I would, again, like think about what's actually possible. So don't say that you're going to survey or like talk to 50 community members if you know you don't have capacity to do that, because you'll rush through it, you'll resent it, and actually building things into the deliverables that feel possible. And these are also the kinds of things like you can also ask community members how they want to be engaged or engaging, and build some of that into there. Like, these aren't things that you have to invent yourself. Yeah, but also curious if other folks have thoughts on that. I'm trained in research, but I'm so not a researcher. It's not what makes my heart happy.
Thank you, Amber, and thanks, Janae, and officially welcome to Janae. You all got to meet Janae. Yeah, and there was I think Janae put a link in the chat with some examples of what some of those measures might look like, with also indicators around engaged communities. So there's maybe a place to also start thinking through some of that. Amber, I want to just thank you. And I know that you are leaving us with this really lovely quote. So I'll just pause and let you kind of reflect on that.
Yeah. So, I can't ever do a presentation without quoting something from Miriam Kaba, who has something powerful and brilliant to say about basically everything. She's a really powerful Black feminist educator, abolitionist organizer. And one of her quotes that I come back to a lot is that everything worthwhile is done with other people. And it's a simple quote, but I think the worthwhile piece feels really true and powerful. So leave that with you. And if you don't know Miriam Kaba's work, I highly recommend you come to know her work. Oh my God, and we get to meet Pretzel. Okay, that's the actual best part of this whole webinar. What a precious little bug.
I mean, I couldn't leave you all hanging.
Thank you.
This is Pretzel.
He's
been snoring next to me ever since his little outburst. Oh my gosh. Well, thank you so much, Amber. You've also been gracious enough to leave your contact information. So we'll put that in the chat. It'll be free, Pretzel. And, again, I want to encourage folks, if you're not familiar with human impact partners, we did provide links to some of the research, Amber, that you walked through, but also just kind of like poking around the website. I learned a lot, and I'm just so glad that you were able to come and be in community with us and share the way that you all are thinking about this work. It's just really inspiring, and I've learned so much from you in the last 90 minutes. So just so appreciative. Thank you. Thank you. Couple more things. Okay, so for those of you who are state health departments receiving RPE funds and any Delta Impact recipients, there is a part 2 of this session next Monday. And so we invite you to join that. We'd love for you to connect with us on these other channels. And I just want to say a couple things as like closing housekeeping. This was recorded, so we will let you know when the recording is available. Usually we send an email, so you'll know. There will be a brief post-evaluation survey that goes out to you all in a little bit, and there is an opportunity after completing that to receive a certificate of attendance. So if that's something that is important to you, that is where you'll find it. And then we'll be creating a list of all the resources that we shared that you'll be able to download. And then we also do make the text chat available. We take out all identifying information, but sometimes there's not sometimes, all the time, there's really wonderful things shared in there. And so that can be useful. So we will be working on all of that, and we'll send an email when it's available. Just want to thank you all so much for your engagement today, for joining us. Thanks for sailing through some of our tech and animal issues. And again, Amber, just lots of appreciation to you and to all of you for your insights and engagement today. Thank you, Janae, and welcome. And thank you to our captioners as well. So that'll conclude our session for today. If you have any questions or want to follow up on anything, please send us an email. We love to hear from you all. And we look forward to seeing you on the next web conference. Take care. We will see you soon. This will conclude our session for today. I'm going to stop sharing. Stop recording. Thank you all.